Welcome back to Houston Life. If you're suffering with pain, I really am sorry, because it does rob the joy from your life. This next interview might be interesting for you. The team of doctors at NexGenEsis Healthcare are helping patients find relief from nerve and joint pain by harnessing the body's own power to heal. Joining us to talk more about it today, to talk about their treatments that are available, Dr. Joe Fuhrman, Dr. Abhishek Reddy. Thank you so much for joining us on Houston Life. And NexGenEsis patient David Espinosa, thank you so much for being here and taking the time to talk about your journey and your treatments that you've been going through. We'll get to those in just a moment. But Dr. Abhishek Reddy, just an overall, what do you treat at NexGenEsis?
So the two main things that we treat at NexGenEsis Healthcare are going to be neuropathy and joint pain. Going into depth a little bit more about the joint pain, the main type of joint pain that we treat is osteoarthritis, which is that normal wear and tear, that breakdown of that joint space that can lead to a lot of pain, decrease in mobility, and decrease in overall quality of life for our patients.
Oh, wow. And for you, David, you were suffering neuropathy,
yes,
which is different to joint pain. But tell us about what you were going through and why you were feeling pain.
Well, I had to go through chemo because I had cancer. And one of the medications caused me to have neuropathy. And I told my oncologist, and she sent me to a neurologist. From there, I went to a neurosurgeon, just all kinds of stuff, all kinds of x-rays and MRIs, and you know, nothing was getting done. And actually, my sister was watching this show, and she told me about NexGenEsis.
Wow.
So I called them up, and they scheduled me right away for an appointment, and so Dr. Fuhrman did a few tests, and he says, "Yeah, you know, you're a candidate for us, you know, for NexGenEsis." And,
oh my gosh, that must have been a relief after going through so many different treatments and trying to find. Because I think that's the thing with pain, is it's not always cut and dry. Oh, I'm hurting here, which means this is the problem. Like it's really, you kind of have to investigate and look into the cause of that pain. With neuropathy, you hear people say they have neuropathy, but what is it exactly, Dr.
So neuropathy is just essentially a type of nerve damage, right? Lots of different causes for that, including chemotherapy, as Mr. David was explaining, but also, you know, diabetes, poor circulation, rheumatoid arthritis, even traumas, past surgeries can cause these symptoms like numbness, tingling, burning. Typically in the feet and hands, balance is also a big problem for these patients that can make it very difficult for them to get around, move around the house, go to the stores, things like that, and severely diminish their overall life.
Wow. And like I said, it's hard to know, you know, like you're sort of going over a blanket of pain symptoms. How would someone know that they should give you a call, that you're the right place to go? Like, where do people start when they're feeling pain? And how do they know that the pain level that they're feeling is high enough to go and see a doctor?
Well, the problem with that, with neuropathy, is that it tends to be progressive, meaning it gets worse over time. So even if you are just starting to feel the pain or the symptoms that I just mentioned, the numbness, tingling, burning most commonly, even just a little bit, you really should get that investigated to find the cause, whether that be with an orthopedic or a neurological evaluation that we would do at the office. And that way we can determine the cause and give the proper treatment plan going forward.
Wow, okay. And Dr. Reddy, the treatment for neuropathy and the treatment also for joint pain, you're using the body's own power to heal. How does this work?
Yeah, so we use a combination of the patient's own biologics as well as advanced therapies to put the body in the best position to heal itself. When I say their own biologics, we actually extract their own healthy cells, growth factors, and molecules, and then we can reintroduce them into the affected areas. You know, this really helps the body in that healing process and helps to decrease some of the pain, increase some of the functionality for the patient, and increase their overall quality of life.
And David, you have been going through that treatment for a few months now, 4 months now. How's it been going?
It's going good. It's helping me a lot. You know, like Dr. Fuhrman was saying, you know, there's a lot of pain, the pins and needles, the burning, the itching. I couldn't sleep, you know. I've only been going for 4 months, and, you know, all the pain's gone, you know. Not all of it, but, you know, a lot of it.
Where was your pain before on a level of 1 to 10?
Like a 9 and 10.
Oh,
know,
wow.
I didn't even want to walk, and I was afraid to walk, you know, because my feet were hurting. My balance was way off. And So all that is gone now, you know. I still have a little numbness, but I mean, that's expected. It's only been 4 months.
And the treatment will last for a year's worth of treatment?
Yes, ma'am.
Wow, and you're here at 4 months. It seems really unfair that someone would go through cancer treatment and beat cancer and then be faced with pain like neuropathy. So it's good to hear that there is a solution that's working for you. What would you say to someone who is feeling pain? I mean, did you know it was neuropathy? You said your sister saw it on Houston Life and told you to give NexGenEsis a call.
Yeah, she told me about NexGenEsis. But I didn't know it was neuropathy. My oncologist, you know, told me, because I have to tell her, and I said, look, something's going wrong, something's wrong, because my feet are hurting. I can't hold nothing with my hands, you know, because it does affect your feet and your hands. And so when I seen Dr. Fuhrman, he did some tests, you know, and stuff, and determined that's what it was. And what I liked about it is the first time I went, you know, most doctors would tell you, well, come back in a month, come back later, you know. They gave me an actual, you know, did the procedure right there and there the same day, you know, and so that made me feel real comfortable having to go back, you know. I knew what to expect and everything, so.
That's amazing. So that's pretty common when someone comes, like once you know what it is, you can just get them into treatment straight away. Yeah,
absolutely. We had that same day. We could, if we're able to, we can start with treatment that same day and kind of get them on that track as fast as we can.
Helping people find relief from pain.
Absolutely.
Oh my goodness. Thank you all so much for joining us today on Houston Life. David, thank you so much for sharing your story.
Thank you for having me.
So glad you're not feeling the pain that you were in before. So wonderful. There is a special for Houston Life viewers. NexGenEsis Healthcare is offering the first 50 callers who call in and mention Houston Life a free phone consultation with a NexGenEsis provider, which is a really great opportunity to see if you are a good candidate for an exam and treatment. All you have to do is call 832-570-4529 or go online to nexgenesishealthcare.com. And we will be back with more Houston Life after the break.